Good morning, afternoon, and evening to all. My name is Caroline Smith DeWall, and I'm with the Global Alliance for Improved Nutrition. Welcome to If It Isn't Safe, It Isn't Food. Many of the speakers you are about to hear from have been working for many months to consider food safety game-changing ideas for the United Nations Food System Summit to be held in September of this year. At this session, we invite you to join us as we continue that journey. We plan to highlight the importance of food safety for achieving the Sustainable Development Goals, especially the goal SDG 2 to end hunger, to inform stakeholders on developing a coalition for action for safe food for all, and to engage with stakeholders on the next steps for the formation of a coalition for action. I also note that we are joined today by Bonnie McClafferty from GAIN, who will manage that coalition. First, I'd like to introduce our two co-chairs for the food safety work in Action Track 1. Juan Agarwal is Special Secretary of Logistics for the Ministry of Commerce and Industry for the Government of India. And Delia Grace is Program Leader for Animal and Human Health for the International Livestock Research Institute. She's also a professor at the University of Nairobi. Over to Pawan, and when you're ready, I will share my screen for the slides.
Carolyn, thank you. You can share the slides, please. Let me join Carolyn in welcoming you to this very special session on food safety. As you can see that on the screen, if it isn't safe, it isn't food. You know, unsafe food does not nourish. It can instead cause you harm. These are very fundamental, basic facts we all understand. But food safety is much less talked about, particularly in the context of the UN Food System Summit. We are talking about healthy diets. If you unpack healthy diets, there are two parts to it. One is the food safety. The food has to be safe, and food has to be nutritious. So here we are going to focus on food safety, because the food safety management requires a very special kind of treatment and a special focus to address it. In 2015, WHO came out with, the estimates of foodborne diseases, and here are some numbers relating to that. 1 in 10 people globally suffer from foodborne diseases. 475,000 people die every year, and 1/3 of them are children. 42 million healthy life years are lost every year due to foodborne illnesses. And this is only tip of the iceberg, because it captured only 31 out of 250 potential foodborne hazards. Next, please. If you look at how these foodborne diseases are distributed across countries, you can see predominantly in Asia and Africa, and that too microbial origin of foodborne diseases that predominate. And if you look at numbers in developed countries, they are minuscule. The foodborne disease issue and foodborne disease burden is primarily focused in Asia and Africa, in low and middle income countries, mostly children, and mostly coming through microbial contamination. Next, please. So over the past few months, we have been trying to figure out what is required to be done. Getting the food safety right requires a lot of things to be done together. So we zeroed down to 5 game-changing ideas that will, in some sense, capture it all. First is measuring outcomes through a global food safety indicator. WHO is currently working on it. Second is about performance and capacity around food safety through a food safety index. And third, fourth, and fifth are about solutions and toolkits, capacity building, and innovation. Next, please. And all this requires knowledge, innovation, and mainstreaming of various tools and solutions that we adopt in managing food safety. Our goals that we are targeting for 2030 is to reduce incidents of foodborne diseases per million people or mitigate increases in foodborne diseases. The numbers we are still working out, and I'm sure in course of the next few months, we will get some numbers as targets for 2030 as far as foodborne diseases are concerned. A balanced framing of the food safety issue, not only considering high value formal sector food products that are meant for export, but foods that are consumed by low and middle income countries by their domestic population, and particularly focused on the informal sector. The 5 targeted tasks, the safety indicator, the index, the toolkit, but also building knowledge to create support investments for human capital, physical infrastructure, management systems, and infrastructure for food safety management, and building capacities for the system as a whole. So I will stop here and request Delia to take over. Thank you.
Thank you, Pawan. So to dig down a little deeper in what we think will change the game, the first set of activities, what we call a cluster, is around risk assessment in its broadest sense. What cannot be measured will not be managed. And at the moment, we know that foodborne disease is not being measured or managed very well. We gave you some data on the first slide, which said 1 in 10 people in low and middle income countries fall sick. Well, we're fairly sure it's a lot more than 1 in 10 people. And that's the sort of information we need to generate. So we have 3 key tools. One is an index, and this will act as a benchmark and also a way of measuring progress. And it will also be a way to motivate people to when they see consumers, when they see how their country is performing, they will be motivated to put pressure on the decision makers to do better. Along with this will be a food safety knowledge platform, which will help generate that evidence, improve surveillance, understand the multiple burdens, and then a global network of interested people who can come together to discuss and share. Next. And of course, we measure in order to manage. So our second cluster focuses on the even more challenging task of how to better manage food safety. That has got 3 components. One is a solutions center where we bring together the best solutions available so people can come and find them in a one-shop stop. The second is an innovations facility, which offers the resources, the ability to develop new food safety innovations or adapt existing ones, especially for low and middle income countries where the burden falls. And then a toolbox, which again will be the translation mechanism whereby solutions and innovations are able to be translated into use by government, private sector, civil society, and consumers. Next, please. Moving towards the summit, what we see, and as is a common format in this summit process, is the development of a coalition for action for safe foods for all. Already we've had a lot of discussions with member states, private sector, and international government organizations, including those responsible for food safety. And we've come together on a set of action statements and a statement of purpose. You can read those yourself, but you can see they focus on evidence, on risk management, on innovation, capacity building, and empowering consumers. So thank you.
Thank you, Pawan and Delia. And they have led an expert group for the last few months that has taken over 30 or 40 different game-changing ideas and found them homes within these various activities. Now I'd like to introduce a very esteemed panel. I'm very excited to hear them all this morning. First, we'll start with Megan Rhodes, who is the Acting Director of the Center of Nutrition in the Bureau for Resilience and Food Security at the U.S. Agency for International Development. Second is Steve Warren, Director of Global Affairs for the Food Standards Agency and Vice Chair of the Codex Alimentarius Commission. Next, we'll hear from Narani Gaifula, Senior Assistant Director for Food Safety and Quality Division at the Ministry of Health for the Government of Malaysia. And then our final panelist is Caroline Imond, Director General of the International Dairy Federation. Over to you, Megan, to start our panel.
Thank you very much, and good morning, colleagues. It's a real pleasure to be here among such an esteemed group of experts. I'd like to thank you on behalf of USAID for the opportunity to join the discussion today. In USAID's Center for Nutrition, I oversee a portfolio that prioritizes nutrition and food safety in support of USAID's multi-sectoral nutrition strategy and Feed the Future. Under Feed the Future, USAID leads US government collaboration with 12 federal agencies on sustainable reductions in hunger, malnutrition, and poverty, and aligns with the SDGs. And as you all know well here, the consequences of poor food safety practices and their impact on nutrition outcomes can't be ignored. Food can't be considered nutritious if it's not safe. The negative effects of unsafe food make it impossible to achieve our nutrition targets, including improving levels of minimally acceptable diets. Earlier, Pawan spoke of the measurable negative impacts on human health and the economy. So just to recap, 1 in 10 people worldwide becoming ill from consuming unsafe foods, and also the costs that foodborne illnesses costs low and middle income countries about $110 billion a year in lost productivity and medical costs each year. He also spoke about death and that unsafe food causes 420,000 deaths per year, 125,000 of which are amongst children under 5, which is particularly troubling for those of us in the nutrition community focused on increasing and decreasing malnutrition among women and children under 5. If we consider that diarrheal diseases are the #1 cause of under 5 mortality, and up to 70% of diarrheal diseases are caused by unsafe food and water, we can see the clear danger to children of unsafe food. It undermines their well-being and it threatens their lives. So we know that safe food saves lives. These numbers in dollars, in measuring illness, and sometimes measuring death, demonstrates that insufficient food safety systems impede progress towards a wide range of the UN Sustainable Development Goals. There's evidence that most clearly links it to SDG 1 on no poverty, SDG 2 on no hunger, SDG 3 on good health and well-being, and SDG 12 on responsible consumption and production. So there's a wide role for food safety to play in supporting the achievement of SDGs. The good news is that there's a growing body of evidence regarding effective interventions to increase food safety. And in support of the SDGs and in support of nutrition, USAID has been a leading investor and partner among donors in food safety program for a number of years. USAID's Feed the Future Innovation Lab for Food Safety focuses on research to reduce the burden of foodborne illness from chemical and biological hazards. Business Drivers for Food Safety works with micro, small, and medium-sized food enterprises to find market-driven solutions to food safety, particularly in informal markets, and help these businesses become agents of positive change in an effort to reduce malnutrition in market settings. Eat Safe takes a consumer-centered approach to generate awareness and empower consumers in formal and informal markets to make informed decisions about the food they eat, thus creating more demand for safe and nutritious food. We also have a partnership with the U.S. Department of Agriculture, a food safety network, which provides science-based support to strengthen animal and plant health food safety measures in the Feed the Future partner countries where we work. And all of these activities are complementary and use a collaborative approach, driving towards the common goal of ensuring consumer access to affordable, safe, nutritious foods derived from local and regional food systems. And as the evidence base on food safety continues to grow, USAID recognizes that there are still evidence gaps, which were also highlighted in your actions covered earlier, and that these evidence gaps are important to close as we think about development outcomes, including nutrition. So we are continuing to invest in expanding the evidence base related to food safety hazards and nutrition outcomes. So it's really good to see that we are aligned in that effort and that there is a focus on measurement and evidence in the actions going forward. We also understand that if we want to achieve sustained progress in food security, we have to use a systems approach, which includes investments in food safety throughout the entire agriculture and food system. Food safety really needs to be a priority across the entire food system from beginning to end. We have to address food safety holistically and employ an integrated food systems approach to support the most vulnerable populations, including women and children. So in closing, we can achieve our overarching goals of ending poverty, hunger, and malnutrition, ensuring good health and well-being, and protecting the planet without safe food. We can't forge a path to achieving the SDGs without making our food system safer. And I'm pleased to hear more about those solutions that will get us there today from our panelists. Thank you.
Thank you so much. And the work USAID is doing on food safety is really innovative. So we're excited to see the agency moving in that direction. Over now to Steve Warren from the UK. Thank you.
Thanks, Caroline. And I'm speaking here today in my role as Vice Chairperson of the Codex Alimentarius Commission. And I'm pleased, therefore, to see food safety as a key action track for the UN Food Systems Summit, because too often food safety is taken for granted, but it remains a serious challenge for us all. And as the tagline for World Food Safety Day, it's everyone's business. And food safety is central to the work of Codex Alimentarius, which is the international standard-setting body for food safety and quality and for fair practices in food trade. The Codex is a continuously evolving system of international food standards proposed and developed by member countries with the participation of observers from intergovernmental and non-governmental organisations who add their particular expertise, driven by need and based on science. And in Codex, we build a global consensus in a transparent, inclusive and collaborative way to ensure no one is left behind. But the challenge is always in translation of Codex standards, guidelines and codes of practice into action in a range of national settings. The cycle of knowledge, innovation, and then particularly mainstreaming we've heard about. So I'm pleased to see this challenge as a focus for the proposed coalition of action. And our shared goal must remain to advance food safety, especially in low and middle income countries, and especially in informal markets. Thank you.
Thank you, Steve. And it's really important that Codex sees an opportunity here to work with this coalition for action. And now, in a way, our most important speaker is Narini Gaifula, because Malaysia has been such an active partner with us in looking at game changers. Malaysia has submitted a number of game changers throughout this process. So welcome to our panel, and please continue.
Thank you, Caroline. Good morning, good afternoon, and good evening to everyone. Thank you for inviting me to this webinar where we'll share Malaysia's perspective and aspirations for the development of Coalition of Action on Food Safety. Let me introduce myself. I'm Noraini Gaifullah, and it's an honor to be here to participate in this webinar and to participate in the Action Track 1 work for this coalition. I'm based in the Food Safety and Quality Division of Ministry of Health Malaysia, where we are responsible in the activities of planning, implementing, monitoring, and evaluating the activities of food safety and quality to protect public from against health hazards and fraud in the storage, the preparation, processing, packaging, transportation, sale, and consumption of food, and also to facilitate food trade. This mandate is provided under the Food Act 1983 and relevant regulations. Malaysia has established interagency collaboration on food safety control by the formation of the National Food Safety and Nutrition Council since 2001, which is chaired by the Health Minister, and the Food Safety and Quality Division act as its secretariat. At the country's competent authority in food safety, it is our vision to ensure that safe food for consumers is achieved by virtue of tripartite management, where responsibility and accountability for food safety are shared equally amongst various stakeholders. Our participation in UNFSS through the Ministry of Health in Action Track 1 is very important to our country for the development of an effective national food system pathway. It is also important for us to better understand the whole food system concept and approach, as well as the objective and process on the UNFSS 2021. As Carolyn mentioned, recently we introduced the food safety guidelines for home-based food to help home-based food business to meet the required food safety and hygiene standard. We are pleased to share that we are also in the process of introducing home-based toolkits, of which we shared with the Action Track 1 as part of the game-changing ideas that can help kickstart food safety culture among these home-based food business. In my opinion, the Coalition on Food Safety is a great reminder and call for action and commitment from everyone to transform all the conversations that we had in various engagement in Action Track 1 and other action tracks into actionable solutions. This coalition can provide evidence and narrative to government to assess the existing food system and see where they can integrate these solutions according to their priorities. I believe a robust food system that can deliver accessible, adequate, sustainable, safe, and healthy food is definitely in everyone's mind now. In addition, I can see that countries, especially LMICs, can greatly benefit from the partnerships arise from this coalition, taking advantage of the use of science-based mitigation measures and leveraging the use of technology and innovation to address risk and of unsafe food in order to improve and strengthen the national food system. Also, inspired by what had been transmitted during Food Safety Conference in Addis Ababa in February 2019, and later on in Geneva in April 2019, Malaysia welcomes the World Health Assembly resolutions on accelerating efforts on food safety, in which, in our view, triggered the realization that the need for specific food safety indicators on the SDGs. With strong foundation and support from the FAO and WHO, the idea of a specific SDG indicator on food safety is timely and very much needed. In conclusions, I believe that the current global situation and changing era of food safety call for bold and resolute actions to ensure safe, healthy, and sufficient food for everyone. In this sense, we firmly emphasize that the solution to food security and sustainability could only be achieved ultimately by integrating it with food safety. Food safety is everyone's business, just like what Steve says. If it isn't safe, it isn't food. Finally, we look forward to participate actively in making this coalition a reality and to contribute meaningfully with everyone towards realizing this SDG by 2030. Thank you very much.
Thank you, Nurani. And I mean, your participation so far, both as we've moved forward, has really demonstrated there's a lot of innovation already happening. But making regulators around the world aware of what's available is a role that could be played. And now I'm very happy to hear from our final panelist, Caroline Imond, from the International Dairy Federation, giving us a private sector perspective.
Thank you very much, Caroline. Just a few words on the International Dairy Federation. IDF has been the leading source of scientific and technical expertise in the dairy world since 1903, working with Codex and ISO on food safety particularly. So we regroup a community of dairy experts from more than 43 countries, representing 75% of world milk production. So thank you for the opportunity to participate in this very important event. You've heard it before, food safety is at the core of the food system and is also key to deliver on the UN SDGs. Good food safety is essential to guarantee public health, to strengthen the trust between consumer, farmers, and the food chain, and also to reduce food loss and waste. I don't know if you know about that, but there's actually a World Food Safety Day that has been created in 2019 exactly to raise awareness on the importance of the subject and our collective responsibility. So IDF is very pleased to participate in this new coalition that will raise awareness on the importance of food safety and also on the need to further coordinate action and education. Food safety is everyone's business. It is through constant collective efforts of all actors from the food chain that food safety and then food security is achieved. Thus, the relevance of this coalition of action. The food safety journey begins with the adoption of international science-based standards like Codex, and then their implementation by national government. After that, well-informed actors will play their roles in risk-based food safety management plans that will allow all aspects of food safety system to be taken into account, ensuring that combined efforts of all operators along the food chain provide safe and suitable food products. All private actors, from farmers to transport, testing equipment suppliers and laboratories, processors, distributors, vendors, retailers, and consumers have a role to play. For example, producers should ensure that good agricultural, hygienic, and animal husbandry practices are employed at the farm level. Manufacturers should utilize good manufacturing and good hygienic practices. Distributors, transporters, and retailers, including street vendors and informal channels, should assure that food products under their control are handled and stored properly and according to the manufacturer's instructions. And finally, consumers should accept the responsibility of ensuring that food products in their possession are handled and stored properly, again, according to manufacturer's instruction. Increasing awareness, sharing knowledge, and building capacity, particularly where some are needed in some market and with some actors, can make a significant difference in delivering the UN SDGs. Thank you.
Thank you, Caroline. I'm going to move actually to our final speaker and then to the question and answer period. And partly we really would like to hear from Luz de Rigel from the World Health Organization. She's the unit head of multi-sectoral actions in food systems for the World Health Organization. And I want to move to her next, in part because we have some questions that talk about linking with other aspects. So Luz, over to you.
Thank you very much, Caroline and colleagues, for these comments. I am very glad to see that the support, to hear the support that our colleague from Malaysia is giving to the food safety strategy that WHO is developing and the indicators. That is critical because we are trying to engage as many actors as possible in the feedback to the strategy but also link it to the indicators work. And clearly this working group in the action track #1 has been very, very supportive of that. And it has incorporated that into the cluster that we are discussing today. So Caroline invited me to talk about the synergies that between the action track #1 and the action track #2 within the Food Systems Summit. For those who are not familiar, the summit has 5 action tracks, and the second is focused on the shift to sustainable consumption patterns. WHO is an anchor agency for that action track #2. Within that cluster, there is a solution cluster, within that track, because the jargon in the Food Systems Summit is evolving as we speak. Within that action track, the #2, there is a solution cluster that is focused on One Health, the One Health approach for people and planet. For those who are not familiar with the One Health approach, it is a collaborative, multi-sectoral, and transdisciplinary approach with the goal of achieving optimal health outcomes, recognizing the connections that are between people, animals, plants, and the shared environment. That cluster is particularly focused on zoonotic diseases and antimicrobial resistance as critical health challenges that the COVID pandemic has made more evident at this point. The pandemic is forcing us or inviting us, depending on the perspective, to think more about how we produce and trade animals, live animals, and how our food production and food supply are vulnerable to disruptions. Disruptions in air, land, and supply chains in general. There are several actions proposed in that action track #2. For example, you can go to the website and you will see it, but I will just point out, for example, the use of collective research, innovation, and data to maximize the building on existing efforts. That clearly is a synergy with the cluster on food safety. Enhancing legal frameworks, including through the Sustainable Food Systems Framework, broadening access to training and technical support, and preventing, of course, the emergence of zoonotic diseases. It is clear that food safety is more than zoonotic diseases and antimicrobial resistance, but adopting a One Health approach that takes into account animal, plant, planet, and planetary health would be more effective to prevent and detect foodborne events from zoonosis to chemical contamination. So I wanted to bring these synergies to the conversation because I see that there are many synergies between clusters, and all of us that are working in food safety can work a little bit more in creating these synergies in surveillance, research, and country support. I will stop here, Caroline, and go back to you.
Thank you. So we have a number of questions, and I'm going to consolidate some. So I think I want to start with the question that came in on linkages between chemical and biological hazards and also climate change. So the question is, how can we understand the important linkages between the climate, chemical contamination of the food supply, microbiological contamination of the food supply, and whether we have the, how do we connect these actions? So I'd like to start with Narani and then move to Luz on that particular question. Narani, do you mind starting us on this linkage between chemicals and microbiological hazards and climate? And I'll just note that consumers frequently find chemical hazards of greater concern than microbiological hazards, even if the evidence that WHO, for example, is presented say that actually microbial hazards are greater concern. Over to you.
Okay, thank you, Caroline. Yes, I agree with you that consumers are concerned on something that they can see, what they can it's tangible for them, whereas microbiological hazards, it's something that is microscopic, that they cannot see it. In this regard, chemicals, especially on the byproducts of metabolites of fungus, so for example, like aflatoxins. These are a direct linkage to the climate changes that happens, because of the productions, the climate changes that happen, and I think because it's not something that consumer still cannot grasp. It's something they cannot see. It's not something that tangible for them. So they are not really concerned about aflatoxins. So that's my take on this.
If you don't mind, Caroline, I will pass the answer, the question to the, Grace, or Delia Grace, that because she has a lot of data on this particularly, and I think that she can provide a lot of information on it.
Great, Delia.
Thank you. Yes, as Norina said, that they are intimately linked. One thing, as Caroline said, the biggest known burden of foodborne disease comes from microbiological hazards. That's not to say there isn't a lot we don't know about chemical hazards. And microbiological hazards are often what we call climate sensitive diseases. That means when the climate changes, they change. They may become more frequent. They may come to different places. Others of these diseases are associated with extreme events. Cholera is notably associated with flooding, and flooding is supposed to get worse under climate change. Also, climate change more indirectly changes the way people practice agriculture. And when they're practicing agriculture in more extreme and difficult situations, they may be more inclined or more reliant upon chemicals and other inputs which can transfer over to food. So it is a close relationship, and one of the many likely externalities, negative side effects of climate change, our food will get less safe. Thank you.
Thanks, Delia. Okay, the next question is to Megan Rhodes on where does USAID see the most important evidence gaps in the area of food safety?
Thanks very much. There are a few I'd like to highlight, and actually one would be building on the conversation that we just had, is that we need to understand better these linkages. We know that they are there, but understanding how to build out the evidence base between food safety and climate change is something that we will be taking an additional look at, especially given the priority of addressing the climate emergency at USAID. In terms of food safety more broadly, I think I want to emphasize a couple of places where there are evidence gaps. And one is, I think, about scaling. So we actually do have a growing evidence base on which policies, practices, and technologies should be scaled, but we really do need to learn more in terms of building the evidence about how to scale in different contexts. We need to understand, for example, what factors contribute to improved food safety in informal markets, and understand that at scale and being able to apply that in different environments. The role of consumers, I would say, is also an important evidence gap that we need to be able to fill. We know that consumers can play a role in driving improved food safety management, but that requires new evidence to translate into meaningful policy recommendations. We partner with Eat Safe on some of these very issues. And then I think there's a whole body of research that gets beyond my own technical capacity, but just really understanding the linkages between food safety and nutrition based on levels of contamination. So we have lots of questions about sort of levels of contamination that may present at a subclinical level that may not necessarily cause illness, but are decreasing sort of the nutritional value of foods. And we also have questions about sort of multiple contaminants within the same nutritious food item. So at various levels, there are evidence gaps to fill at the policy and scaling level, what we understand about consumers. And then I think there's more still that we need to understand about the science of how food safety interrelates with nutrition in real world settings, so that we can address the risks and hazards that are most prevalent in different markets and in different countries, so that policies and regulations and partnerships can be built to address context-specific risks. Thanks.
Thanks, Megan. We have a series of questions on the role of indicators and indexes. So I'm going to pass this question to a couple of our speakers. Pawan, I'm going to start with Pawan on the question of, so let me just tell the speakers who's going to be commenting on this. Pawan will start, and then Narani, I'll give you a chance if you want to illustrate how it might work, and then Luz. So now that I've got your attention, the question is about how indexes might work to help countries, specifically developing countries, show how they're performing, where their gaps may be, and how also for Luz, how an SDG indicator for food safety might work. So starting with Pawan, then Narani, then Luz.
Okay, thank you, Carolyn. I think this is a very good question because what gets measured gets managed, and obviously the best indicators would be outcome indicators, and that is what the SDG indicator that WHO is currently working on aims at creating an outcome indicator for food safety, and Luz will perhaps give you more details on that. But since food safety in many countries is still evolving, capacity and performance measurement can become a very good tool to inspire action from the nation governments to focus more attention on food safety, to invest in food safety, to provide staffing for food safety, etc. And let me tell you, with the experience in India, it's not very expensive to do it. There are countries that can put in place a very robust food safety system without huge investments that perhaps developed countries have made, and that those models are currently available. I'll stop here.
Thank you, Narani.
Okay. At the moment, we don't really have a harmonized food safety index that works for everyone. So each country have their own measurement tools, if any. This index should be measurable and which can identify gaps and also strength where the country can capitalize it. The outcome indicators is good, but we still need output and processes to process the indicators, to process all the inputs and outputs of it. Country basically knows what is lacking, but what becomes priority is another question. For example, diarrheal foodborne illness in itself is not enough. It's not sufficient to measure food safety status in the country. So there are many aspects, many factors that can be used to measure a country's performance. So it's not really something that is how to say I'm not so for that. Anyway, yeah, Malaysia is working at the moment in developing food safety index, and we are looking at countries that already have this food safety index, like India and in Africa, and we look forward to learning from them as well. Thank you.
Thank you. Very helpful. Luz, any final comment on the SDG indicator?
I mean, we believe that a SDG indicator can help mobilize a lot of action in food safety. It has been a hard task trying to find the right indicator because, as we have been discussing, food safety includes many, many things. The challenges that we have at this point is balancing between inspiration, something that can inspire action, because it's not only the indicator, it's the target associated to the indicator, how much we want to advance. What the WHO is proposing at this point as part of the food safety strategy is an outcome indicator that is the reduction of diarrhea due to foodborne diseases. And we have a target of reduction of 40% at this point, a tentative target of reduction of 40% between now and 2030. We have received a lot of feedback in terms of whether that is feasible, that is achievable, etc. Whether that's enough. The fact that we are having this conversation is really, really good, because now we know that if countries are behind it, then we know that we can improve surveillance systems. Then we know that they will be committed to report to the WHO Assembly to be able to monitor progress in food safety. However, we are conscious that that's not the only thing. As Nurani was saying, we need process indicators. So also the strategy is proposing at least 2 indicators that are already collected by IHR, which is the availability of surveillance systems, whether the surveillance systems have the capacity to detect events and response. And the second is whether there are multi-sectoral coordination mechanisms to be able to establish these connections. We know that that's the first step, and I want to differentiate 2 things: global surveillance from national surveillance. And the indexes, sorry.
Yeah, we need to wrap up. So, yeah, sure. But that's really great information. I want to turn to one more of our panelists and then to Pawan to close us out. But the final question is to Steve Wern, and that is how do you see the Coalition for Action and the game-changing ideas that have been put forward helping Codex get its standard into place in countries? And then directly, Pawan, you can take over to close us. Thank you.
Thanks, Caroline. As I said earlier, I think the significant challenge we always face is in translating standards and codes of practice that are developed in this inclusive and multilateral way into action in member countries, given the varying capacities that countries have and the challenges there might be within national markets, particularly those that depend significantly on informal markets. And this isn't a new issue. It's been diagnosed by the World Bank and by other commentators over the past decade. So anything that helps that process of effective translation, turning standards, science-based and multilaterally agreed standards into action in low and middle income countries and informal markets would help. And I suppose this is an ambition that many Codex member countries I've spoken to share, using this opportunity to develop new tools, new approaches and methods that can be shared and promulgated for making real change happen on the ground and improving food safety. And that's why I find it so exciting. Thanks, Caroline. Back to Pawan.
Thank you. Thank you, Steve. I'm sure that like me, all of you enjoyed this conversation that we had for the last 45-50 minutes. Let me, in my closing remarks, touch upon 3 brief points. First, what Megan started, safe food saves lives. It also nourishes people. So it is at the front and center of the food system transformation, and yet it is not getting the attention it deserves. It is taken for granted. I think this is an opportunity to bring it to the center stage, the food safety issues, because it touches upon several SDGs. It also touches upon all the other action tracks, action track 2, as Luz mentioned, and other action tracks as well. Second point is that focus has to be on food safety in low and middle income countries, fresh food in wet markets, informal environments. So this has to be the focus moving forward. And third is that addressing food safety challenges require multi-stakeholder action. It requires global cooperation and collaboration. I think synergetic development of the coalition that the INVISE is forming is the way forward as we move towards the Food Safety Summit in September. Thank you very much.
Thank you, Pawan. And we're ending almost on time. We have a ton of questions, so this could have gone on for much longer. But thank you all for participating, to our panelists and to all the attendees. We had many, over 160 people in attendance. So thank you all for coming.
Thank you, everyone. Thank you.
Thank you.
Yeah.
Thank you all.